welcome to all our returning doctors to another Doctors Forum, and also to our new doctors for joining us and new medical practitioners. Welcome to Simply Nature's Doctors Forum. Tonight, our topic is very unusual, but it's one that's been requested by you, our doctors, which is to understand a little bit more about oncological protocols for the treatment of cancer, specifically chemotherapy. Why should patients still use chemotherapy, especially with the trend right now of wanting to explore natural therapies? Our special guest tonight is no stranger to alternative and integrative medicine. In fact, he appreciates it, but yet he is an oncological surgeon who prescribes chemotherapy to his patients and performs surgery. So our guest tonight, Dr. Jimmy Katapia from Manila Medical City, is very qualified to give an unbiased view and an unbiased review of chemotherapy so that our doctors, yourselves, can be more comfortable with this topic and see how you could actually potentially work with your patients who are undergoing chemotherapy. Welcome everybody, and I'd like to have a special thanks to our special guest today, which is Dr. Jimmy from Manila Medical City. Dr. Jimmy is a very experienced oncological surgeon, and he is well versed in the treatment of cancer from many types. And we're just so honored to have him here today to have a chat about oncological procedures, about chemotherapy, so that both our doctors and our viewers can understand a bit more about this topic. So, Dr. Jimmy, welcome.
Thank you, Sir Sean, and good day to all the viewers.
Yeah.
It's nice to have you here again.
And a new venue today. We are taping in a new venue today. Doc Jimmy, when we talked to, yesterday I bumped into my neighbor, and she is undergoing chemotherapy. And as I talked to her, I realized she has very little idea about the chemotherapy she's taking, and she's just not sure about what the drug she's taking. And I do notice that that's the case with many cancer patients, that they don't really understand chemotherapy and its uses and what's going to happen to them. So we hope that today, having you here on board, that you can answer all their questions later during the Q&A and also give them a good overview. Dr. Jimmy, but before we begin, Dr. Jimmy, I'm looking at the statistics for Philippines. Total number of cancer patients in Philippines is about 1 million, and just in new cases is 153,000. And these are the existing prevalent cases, 5-year. Wow. So on the ground, what can you say about the cancer rate in Philippines?
Actually, there are many cancer patients in the Philippines. Actually, what we see in the statistics from Globocan is actually underestimated, because the source of these data are from few chosen government hospitals only.
Okay.
So we do not have a data on the private patients that have breast cancer, and also in the far-flung areas of the Philippines. So this is actually just an estimate.
So the real number of cases are even far. And here it says that lung cancer, colorectal, and prostate, liver are the most common for males, and for women it's breast, cervix, colorectum again, and lung and ovary. Wow, I was surprised to see lung cancer being so prevalent. Lung cancer is quite hard to treat if it's later stages.
It's very common among males.
It's very common among males. Okay. So cancer is here to stay, and statistics have shown that it's almost like 1 in 10 easily, maybe even 2 in 10. And as the years go by, this rate is going to continue to go up. Doc, before we ask you about oncological protocols, maybe a little bit about your history. When I first met you, I heard how you started, and I was a bit surprised because you were quite open to natural lifestyle medicine, and you're quite open, and you actually told me nutrition is important. That's very different from the standard answer we get from some oncologists that our patients have encountered. Because one of the most common things patients ask their oncos is, "Doc, what can I eat?" And the answer is, you can eat anything, but that's a bit different from you. You actually pay attention to nutrition. So, Doc, why is that?
Actually, I trained in Philippine General Hospital for my residency in surgery and also for surgical oncology fellowship. My mentor during that time has a classmate who is in integrative
Oh, is in
medicine.
integrative
My
medicine.
mentor introduced me to her.
Okay.
So, I also learned from an integrative doctor.
Alright.
I became friends with the integrative doctor who is also a classmate of my surgeon mentor.
Alright. So actually, so Doc Jimmy, your background is quite different from the standard oncologist. You are actually very open and you understand all the natural integrative approaches. So, so to all our audience, I think this is really great because Doc Jimmy is not just pro chemo and his knowledge base is not just that. He's well versed in integrative medicine as well. But Doc, even though you understand and appreciate the natural side, could you perhaps share with our doctors and also with our patients why chemotherapy is still so important? Why not just natural? I mean, you recognize that natural is important, but why is chemotherapy still so important?
Okay, that's a very good question. So until there's already a magic drug that can treat all, no? For now, we have to do chemotherapy because chemotherapy drugs are well-researched drugs. They are scientifically proven. Uh, Usually, before a chemotherapy drug is introduced to the market, they undergo many steps in research, no? They first test it in the laboratory, then in animal models, then human models.
Mm.
So the process almost 5 to 10 years, sometimes 15 to 20 years.
Before the drug can be
Yes,
freely
before
administered.
a drug can be given to the as a commercial drug, no, can be given as a commercial drug. So it really is an evidence based. That's what we call in Western medicine. Those drugs are evidence based products. So they are scientifically proven. Their safety as well as their efficacy are very much known
And documented.
and documented.
Doc Jimmy, how long have you been applying or using chemotherapy protocols?
Even during my residency and fellowship training,
So
and even
that's-
up to now,
So is that about more than 10, 15 years,
I
right?
think more than 20 years.
More than 20. I wasn't gonna give out his age. Right. So over the last 20 years, for patients and many integrative doctors, I think there is still a hang up on the negative side effects of chemotherapy. But since you've been practicing and using chemotherapy protocols for so many years, 2 decades, have you seen any changes? What are the changes in the chemotherapy drugs? Have they improved over the years? Yeah, your comments about that.
Of course, the chemotherapy side effects are always there.
Mm.
As clinicians, we should explain to the patients what the chemotherapy drugs that should be given to them, as well as the possible side effects, so that they won't be surprised if they experience a side effect. And of course, if they experience side effect, they know what to do. So that's the number one thing to do for your patient. Number two, you have to know how to lessen those side effects, or if possible, make those side effects go away totally.
Wow, I think that's very, very interesting and very important because for patients especially, we keep hearing about side effects of chemotherapy. It's probably a first for some patients to hear that an onco actually would make provisions to lessen the side effects of chemotherapy. So, Doc Jimmy, for your own practice, how do you approach this side effects of chemotherapy, and what do you do before you met us?
Yeah.
Before you met Simply Nature, what did you do, and after you met us, what do you do?
When I was just starting my private practice, of course, I only apply what I learned in the hospital,
Okay.
in PGH, to give antiemetics for vomiting and nausea, to give proton pump inhibitors and H2 blockers for the stomach side effects, no? As well as for other side effects, we can give paracetamol for fever. We can give GCSF, or those filgrastim, what we call filgrastim, to battle leukopenia or depression in the bone marrow. No, that's what I only do. But I think it's not enough. I realize those things are not enough because many of the patients actually are afraid of the side effects. I think that's the number one reason why they do not want to have chemotherapy, and why they do not want to continue chemotherapy.
That's true. That's also our experience with patients. But I mean, the good side is some patients have almost zero side effects from chemotherapy, but there are many patients also where even after one session, they feel so terrible that they don't want to continue.
Yes, each patient actually is different. There are some patients who only have one side effect or no side effects at all.
Yeah,
There are some patients who will have all the side effects.
All the side effects.
Or written in the brochure of the
everything.
The drug.
So how do you approach this? What do you do?
Sometimes you cannot do anything anymore after I've given all the possible drugs. I just reassure them it's okay.
So is that where
your body will adjust? But actually, it's frustrating.
Is that? I mean, I remember my first meeting with you, and I was very encouraged because when I first met Dr. Jimmy in his clinic many years ago, I remember I told him that I believe that chemotherapy is effective. It's effective in killing cancer cells. And it was very encouraging for me because it was Dr. Jimmy who said, yes, but chemotherapy also has its side effects.
Downsides.
Yeah, I didn't expect Dr. Jimmy, the onco, to be the one acknowledging the side effects, especially since I represent Simply Nature, and he knew that we were nutraceuticals, right? And we were on the natural side of things. But what got me and Dr. Jimmy talking was I asked Dr. Jimmy this question, which was like, Doc, if we can reduce the side effects of chemotherapy, would it help your patients? And that's when he smiled. He didn't kick me out of his clinic. And we began this exploration and this partnership and the friendship that has lasted, I think, 5 years now. I think almost 5 years.
Almost 5 years now.
And then we've helped many patients along the way. So later, Dr. Jimmy will share maybe how he started and what convinced him about how our products and protocols can help. But today, Doc, I do want to ask you, chemotherapy is proven effective. It is very useful, but at the same time, there is a phenomena that will happen, I think, which is drug resistance. I think this is the part where perhaps you can share with patients and the doctors where the limits of chemotherapy is, because sometimes I get this a lot from patients. They're doing very well. The tumor shrank 75%, from 3 centimeters to now it's less than 1 centimeter. So the chemo is working, everything is working, and suddenly it stops working. Could you enlighten us what happens in those cases?
Actually, cancer cells are like cells or virus cells. No? They can adjust, they can mutate. So when they adjust and develop drug resistance, your chemotherapy treatment and even your targeted treatment will not work anymore. So number one reasons why your chemotherapy is not working and why there's drug resistance. Number one, maybe you're not giving the appropriate drugs. No? Okay. Number two, this is a very common reason for drug resistance: delay in chemotherapy, interval between cycles or sessions of chemotherapy. And what's the reason for delay? The side effects and financial reasons.
Oh, okay. Both are very real reasons.
Yes.
I really want to look at the side effects reason for drug resistance. But before we go into that, what is drug resistance in chemotherapy?
It is, for example, during the first chemotherapy session, you will see a considerable decrease in the size of a tumor. So it means the drug is working.
Yes.
Yes, but after some time, maybe after the second or after the third chemotherapy, you will not see any more response from the tumor. Or maybe even the tumor may be even growing big again.
Yes.
So that is drug resistance.
A simple diagram that we're flashing up will help you understand. Every time chemotherapy or any drug is being applied to your body, not only for cancer, but especially for cancer, is that some cancer cells will start to be resistant to it. And given over time, these number of cells increase in the tumor to the extent that the tumor now becomes drug resistant. So as Dr. Jimmy, as you have highlighted, So the delay. So that means that if a patient going through chemotherapy becomes weak in the interim, and we have to delay the treatment because we have to let the patient recover, that actually raises the statistics or probability of drug resistance because the cancer tumor has more time to react.
Yes, because of the delay in treatment, there will be new cancer cells that will repopulate the small tumor, no? And this will predominate. This will be the new resistant cancer cells.
Okay.
Already mutated.
So I think to all our listeners and to doctors who are supporting cancer patients going through their chemotherapy, one important thing to note is you got to go into your chemotherapy strong, and you got to stay strong. You don't want to delay the prescribed appointments, your chemotherapy schedules, because if you delay, then what is working might suddenly change.
Yes. And to prevent delay, we must lessen the side effect or totally eliminate the side effects.
So you mentioned after you use drugs and some patients just don't, the drugs are not enough. Maybe you can share how our meeting changed maybe some of the treatments of your patient.
Okay, I remember during your first meeting,
Yeah.
you introduced to me the product.
Yeah, were you
The simulator.
skeptical?
Yeah, of course. I do not know you personally before.
Yes, correct. We were absolute
Yeah.
strangers, right?
And I'm trained in the Western medicine way.
Yeah.
So, but during that time, I was really frustrated because I have a colorectal cancer patient. After the second cycle of chemotherapy, she doesn't want to continue the chemotherapy anymore because of the side effects. There's depression in the bone marrow, what you call leukopenia.
Okay.
She also has considerable weight loss because she cannot eat. She always vomits. That's when I thought maybe I should try the product to this patient.
Okay.
Okay, and then yes,
What
I was
did-
surprised.
You were surprised.
Yes.
What did you give that patient? Was it liquid or soft gels for this particular patient?
Actually, your Emerson, no? Emerson gave to me the capsule.
Oh, the capsule
So
first.
I gave it for 3 times a day.
Okay.
Dosing for the patient.
Uh.
And she gained weight.
Oh,
There's lower incidence of vomiting and nausea, and we were able to complete the 12 sessions of chemotherapy.
Wow.
You know what? I was giving that patient cisplatin and capecitabine
Okay.
because this is a colorectal patient.
Yes.
And then, actually,
The
you
research-
you gave me a research.
Was on cisplatin.
Cisplatin and oxaliplatin. So,
Yeah.
so that's why. I know that's why.
But if you could you summarize what makes it different? What made you comfortable, apart from our years of friendship, to prescribe Simply Nature extracts to your patients? Because it is, even up to today, still unusual for an oncologist or any practitioner who's prescribing chemotherapy to recommend any form of supplementation apart from eat more bananas and fruits and vegetables. So what made you comfortable with our extracts?
In my several years of practice as a clinician and as a surgical oncologist, and during my experience also of giving chemotherapy, I find that conventional drugs used to combat side effects of chemotherapy are not enough. No? There are still many patients who will have many side effects of chemotherapy, and that will cause delay, and also some will stop the chemotherapy session. To be honest, I actually tried many supplements.
Oh, you have
Because you're not the first person to
not
approach
the
me.
first
Yes.
person to approach.
I actually tried giving those stem cell activators.
Yes. Oh, yeah. Those used to be popular at
Yes.
one time. Yeah.
Even many algae-based supplements.
Yes.
Yes, actually, I tried all of them to my patients. But as a clinician, I want outcomes. It should be outcome-based. And it is also only in Simply Nature PPAR that I was able to have my desired outcome. Yes.
Which is that your patients recovered from the side effects
Yes.
of the chemotherapy.
Much lesser weight loss, much lesser vomiting and nausea. And some, they even say they got stronger even during chemotherapy session.
Even during the chemotherapy session, they got stronger. Yeah. So thank you, Dr. Jimmy, for trusting us. And there you guys have heard it. That's the reason why Dr. Jimmy prescribes Simply Nature extracts. And Doc, I didn't know that you've tried other algae products. So to all our viewers and doctors out there who are asking, there are other algae products, aren't they the same? Well, they're not the same. As Dr. Jimmy said, it is the outcome, seeing the results. So Simply Nature extracts deliver the results. And thank you, Dr. Jimmy, for using us to treat your patients.
Thank you very much.
So for all the doctors who are new to us and to our viewers as well, we actually tested our Simply Nature extracts on chemotherapy drugs, both cisplatin and oxaliplatin. So these drugs are actually the most common chemotherapy drugs used in at least 14 different types of cancer. And they are because to the viewers, to the patients, you may not know, but most chemotherapy is cocktail form, right? More than one chemotherapy drug. So cisplatin and oxaliplatin are one of the most common denominators found in many chemotherapy cocktails. So yeah, we tested it, and right now, a lot of your patients, you actually prepare them through using soft gel capsules.
Yes. Some of my patients, I gave them the powder or the vial. Actually, depends on the stage. If the patient has an advanced stage, like stage 4, stage 4, I initially give them the vial or the powder
to prepare them.
Yes, and during the maintenance phase, then I ship
to the
soft gel capsule.
Wow. So, Dr. Jimmy, I think that's really interesting and very encouraging. And to the viewers out there, if you are looking for an oncological surgeon, there's no better one than Dr. Jimmy. Dr. Jimmy, you practice at Manila Med. So those of you, we will flash his contact details for all the viewers who are interested to find a surgeon, a unique surgeon like Dr. Jimmy, who has background, friends in integrative medicine, but still firmly rooted in his conventional medicine, but is also incorporating concepts where to strengthen you through your chemotherapy, through your surgery. There's no better person that here on our program that we would recommend than Dr. Jimmy. So yeah, Dr. Jimmy, any last advice for patients? Okay, wait, you do surgery, so let's take the opportunity. How important is surgery in the treatment of cancer? Because again, one of the most common questions that our viewers will ask is, can we avoid surgery? So what's the advice when it comes to surgery and cancer?
Okay, for solid tumors, when we speak of solid tumors, surgery is still the primary modality of treatment. Okay, we need to remove the primary tumor, and then to prevent recurrence of the tumor or the cancer, that's when we do the chemotherapy, the radiotherapy, the targeted therapy, or other forms of therapy. Okay, so for all the viewers there, and also for all the doctors who are listening right now, do not be afraid of chemotherapy. Chemotherapy is really effective. I've proven that during my more than 20 years of practice.
And now, especially with protocols that can mitigate and reduce the side effects of chemotherapy.
Yes, and there are newer types of chemotherapy drugs with lower or lesser side effects.
Which makes, again, if you have protocols that you can work with us to lower the side effects, and with the new more targeted chemotherapy drugs, that just means that we are effective on both sides, and it's just going to be great for the patient. Dr. Jimmy, one last question so that we can also be fair, because I'm sure the viewers will want me to ask you this question. Are there situations where surgery is not the option for cancer?
Yes, there are many situations. For example, very advanced stage 4 cancer. So in those situations, surgery is not anymore the number one option. Usually, the number one option is chemotherapy, or targeted therapy, or hormonal therapy. Depends on that type of cancer. And also, of course, for hematologic or blood cancers, there's no surgery.
Yeah, there's no surgery for that. Yeah. So again, I asked that question so that our viewers will know that it's not just because Dr. Jimmy is an oncological surgeon that he will actually prescribe surgery as the primary. There are situations where surgery is no longer an option, and that's usually when you are in the late stages, which also implies that if you're in the early stage, go for your surgery. That will be one of the best things that you can do. And then as we have learned in our program, and we can share more during the Ask Me Anything segment. Chemotherapy is often used as a sweep up to ensure that there are no lingering cancer cells. And throughout this whole process, as Dr. Jimmy has enlightened all of us today, it is very important for cancer patients and hence for other secondary practitioners that support the cancer treatment process that we strengthen the patient nutritionally by choosing the right supplements. And here in this case, Simply Nature actually tested our supplements with chemotherapy drugs so that you are assured that there's no contraindications and that they have the right results because it's actually being used by oncologists like Dr. Jimmy, and they see good results with their patients. And it's really encouraging. Patient who didn't want to go for chemotherapy felt strong enough to finish 12 sessions of chemotherapy. So once again, Dr. Jimmy, thank you for your time. I hope you can stick around for the quick Q&A.
Yes.
These doctors might have interesting questions for you. So once again, thank you everybody, and let's go to our Ask Me Anything segment.